I will talk to you about what could happen badly during hair transplantation or after hair transplantation. I will try to summarize I will try to talk about it. First of all, hair transplantation is a surgery where patient's expectations should be met by the surgeon. So the surgeon will tell his experiences what patient could expect. So it should match together. This might be one of the worst things that could happen after hair transplantation, that expectation cannot be met by the surgery. This is important. Plan is also important for the reason that you might have some hair transplantation in some part of your scalp, but the other area where you already have hair, you may lose this existing hair in the future, and it will give you another fake look when you have some hair here and let's say some hair, implanted hair here, and here is empty. So it might not look very natural. When we talk about natural result, means that your surgeon will guide you where the hairline should start, because we are using some parameters. One of them is the facial muscles, the other is the bone structure of the head. Also the density is important. Also your expectation is important, because when you try to cover all the head with small amount of grafts, then you cannot give high density to get a natural result, because almost always natural results, almost always, not all the time, comes with high density. I have many patients who have very low density, previously had hair transplant, who had very low density of implanted hair. Doesn't look natural enough, because the extracted hairs is really thick. When we are doing the hair transplantation, the clinic itself and the surgical environment should be clean and sterile enough. If it is not, then another infection is kind of a risk that could happen in the surgical area. After operation, we will need to manage the infection with antibiotics or locals or oral tablets to manage the infection. This will cause loss of the implanted grafts. Also may cause a scar of the scalp tissue, which will end a very bad look. This is another bad thing could happen after your hair transplantation. And the second thing, what could happen during the surgery, that we are using anesthesia for the surgery, local anesthesia mainly. Sometimes we use the sedation. If patient doesn't want to feel any pain during the surgery, we may use the sedation. So there might be some risk of allergic reactions or cardiac problems that might happen during the surgery or after surgery. But if your surgery is taken in a clinic which has all other facilities, which includes the doctors, emergency services, and if they have a first aid experience in the clinic, it means that you are safe, because these risks are quite low. Even we cannot describe it in terms of the percentage. The other possibility that could happen during or after the surgery is insufficient blood supply for the implanted hair, because all implanted hair needs to get blood supply as early as possible, and it should be enough. When it's not enough, then survival rate might get lower. Also, it might cause the necrotic tissue because of low blood supply. So the surgeon, if surgeon has experience of it, he or she will calculate how many grafts should be implanted in how much area by counting the blood supply in that area also.